Hello, my name is Eden Hughes. Today I'll be discussing depression, one of the most prevalent and debilitating mental health disorders in Australia and globally. This presentation will explore its prevalence in the Australian context, key risk factors, treatment modalities, and the critical interaction between trauma and depressive illness. Finally, I'll reflect on how the knowledge gained in SNUG 206 has strengthened my ability to provide person centered, recovery oriented, and trauma informed nursing care. Depression, or major depressive disorder, is characterized by persistent low mood, loss of interest or pleasure, and impaired functioning lasting at least 2 weeks. APA 2022. It affects emotional, cognitive, and physical well being, often accompanied by fatigue, poor sleep, and feelings of hopelessness. The World Health Organization 2023 recognizes depression as a leading cause of global disability. In nursing, this demands an evidence based, compassionate approach that recognizes depression as both a clinical condition and a human experience. In Australia, around 1 in 7 people experience depression in their lifetime. AIHW 2023. The ABS National Study of Mental Health and Wellbeing 2022 found that 15% of adults met the diagnostic criteria for a depressive episode in the past year. Rates are highest among young Australians aged 16 to 24, a group particularly impacted by social isolation, financial stress, and digital fatigue. Depression also disproportionately affects women and Aboriginal and Torres Strait Islander peoples, highlighting intersections between trauma, inequity, and health outcomes. Importantly, depression is strongly linked to suicide, the leading cause of death for Australians aged 15 to 44. ABS 2023. Depression develops through an interplay of biological, psychological, and social factors. Biologically, genetics and dysregulation of neurotransmitters like serotonin and norepinephrine increase vulnerability. Wiley et al. 2021. Psychologically, factors such as maladaptive coping, cognitive distortions, and poor self-worth amplify risk. Socially, unemployment, poverty, family conflict, and discrimination contribute significantly, particularly within marginalized populations. However, one of the strongest predictors is trauma. Adverse childhood experiences like neglect, abuse, or parental mental illness can permanently alter stress response pathways, predisposing individuals to depression later in life. Valetti et al. 1998. Trauma and depression are deeply interconnected. Trauma often precedes depression, but depression can also exacerbate trauma symptoms, forming a cycle of distress. Keane et al. 2020. Neuroimaging studies show that early trauma alters the amygdala and hippocampus, heightening arousal and impairing emotional regulation. Teicher and Sampson, 2016. Trauma-informed care therefore becomes essential. It's guided by the principles of safety, trust, choice, collaboration, and empowerment. SAMHSA 2014. Clinically, this means asking not what's wrong with you, but what has happened to you, reframing behavior as adaptive responses to pain rather than pathology. This approach fosters empathy, prevents re-traumatization, and builds the therapeutic alliance necessary for recovery. Evidence-based treatment combines psychological, pharmacological, and lifestyle interventions. Cognitive behavioral therapy remains the cornerstone, helping individuals restructure unhelpful thought patterns. Beck, 2011. Other effective modalities include interpersonal therapy, acceptance and commitment therapy, and for trauma-related depression, TFCBT and EMDR. Bisson et al. 2021. Pharmacotherapy is essential for moderate to severe cases. SSRIs such as sertraline or escitalopram are first line, while SNRIs like venlafaxine support those with fatigue or pain. RNA-ZCP 2023. Emerging treatments like rTMS and ketamine show promise for resistant depression. Lifestyle modification, including exercise, nutrition, and social support, enhances neuroplasticity and resilience. Each treatment has benefits and limitations. Psychotherapy promotes long-term change, but can be costly and time-intensive. Medication provides relatively rapid symptom relief, but often comes with side effects and adherence challenges. Lifestyle interventions improve holistic well-being, but require motivation and ongoing support. Therefore, the gold standard is integrated multimodal care, combining pharmacological, psychological, and social strategies tailored to the individual. Nursing care begins with holistic assessment, evaluating affect, thought content, suicidality, sleep, appetite, and social context. Tools like the PHQ-9 and K10 can assist, but must be paired with clinical judgment. Evidence-based nursing interventions include therapeutic communication grounded in empathy, psychoeducation for patients and families, behavioral activation to rebuild daily function, and support for medication adherence. Collaborative goal setting ensures care aligns with the individual's values. These interventions reflect the recovery-oriented model, promoting hope, autonomy, and connection. Commonwealth Department of Health, 2022. Nurses are often the first and most consistent point of contact for individuals experiencing depression. A trauma-informed nurse recognizes that withdrawal, irritability, or mistrust may be protective rather than defiant. By maintaining empathy and transparent communication, we foster safety and trust. Collaboration with psychologists, social workers, and peer support teams addresses broader social determinants such as housing or employment. Equally, reflective practice and supervision safeguard nurse well-being against compassion fatigue. Through Snug 206, I've gained a deeper appreciation for how clinical knowledge, trauma awareness, and compassion intersect to create effective, ethical, and human-centered care. In summary, depression is a multifaceted condition shaped by biology, psychology, and lived experience. It remains one of Australia's leading causes of disability and premature mortality. Best outcomes arise when treatment integrates psychotherapy, pharmacotherapy, lifestyle change, and trauma-informed nursing practice. Through empathy, education, and advocacy, nurses empower individuals to rediscover meaning and autonomy in recovery. Ultimately, depression is not simply a disorder of mood, it is a call for connection and healing. Our role as nurses is to answer that call with evidence, integrity, and heart.